joined today by Tim Hurd. He serves as CEO of the Pennsylvania Recreation and Park Society. For those that may not be familiar, can you explain who your organization represents and what your mission is?
Well, the Pennsylvania Recreation and Park Society is the professional association for those who work or volunteer in parks and recreation throughout the state. We provide professional and leadership development, advocacy, and resources to help them do their jobs better.
How have parks and recreational amenities been affected since the onset of the coronavirus in Pennsylvania?
How have they not been affected? It's perhaps the question. Everything has been affected. And you see that everybody has wanted to get to the parks during the pandemic. Google mobility reports reported in, as of the end of May, looking at a trend of a positive 128% increase in mobility of Pennsylvanians to their parks. That is where they're going to find respite from the stress and the restrictions that have been imposed necessarily during the COVID pandemic.
What kind of unique challenges have visitors faced in the fact that there have been a lot of things closed down, whether it's restroom facilities or different amenities that visitors usually come to expect?
Well, again, that's affected nearly everything. Restrooms have been closed, and then some were reopened because things got worse with them closed. But the challenges of keeping things cleaned and sanitized and hygienic has only increased as well. Playgrounds are closed because you can't sanitize an outdoor facility like that. The first child who gets on it, in effect, contaminates it with their touches and so on. So it's not just the facilities, but the programs as well. People aren't being able to get together to enjoy their recreational time. And so the challenges have come back on the Park and Rec professionals, the ones who are providing not only the services and the facilities, but keeping them clean, safe, and ready to use when we get to the point where we can reopen. So PRPS had taken a lead in designing some recreation and park facility reopening guidelines for our members and our agencies throughout the state to use when they try to fit in with the red phase and the yellow phase and the green, and what that would look like if they can meet the requirements set forth by the governor's process to reopen Pennsylvania and the Department of Health and Sanitation and Cleaning and Hygiene and food and beverage and visitors and ratios and groups and square foot and capacity. And so that varies according to facility, whether you're talking about day camps or you're talking about a gym or a recreation center or an outdoor venue where you have concerts or pools and locker rooms and showers. It's extensive, of course, because most of these things are taken care of by our professionals that are unsung. You don't think about that until you get to the park and say, well, hey, the grass wasn't cut here. And now I don't know if I want my children to run through the very high grass where the ticks will be. You notice it when it's not happening, but when it is happening, when the facilities are well maintained, and you go to a pool and you know that the lifeguard has been adequately trained and they are adequately staffed for your safety, people don't think about that quite as much. But there is quite a bit that goes on behind the scenes to make sure that these things do happen. The challenge, of course, is that the world is turned upside down. I like to say that we've been in a spin and tumble cycle for the past number of months. And one of these times it'll stop and we'll land on our feet. We'll look around and we'll say, this is what the world looks like right now. And how do we adjust? And how do we meet the needs that the public wants? Our park going, our recreation seeking residents and families and kin to get outside and find some of the mental and physical health that they are seeking.
Can you talk a little bit more about the workforce that's tied to maintaining these parks and the economic impact that has been felt since the virus has been present in Pennsylvania?
Again, the maintenance aspect of public spaces, parks and green spaces is crucial. We have a history, not just here in Pennsylvania, but across the country, in building new things and celebrating with ribbon cuttings and grand openings, and then not budgeting the money over its physical lifetime to maintain it well. We have more than 6,000 local parks in Pennsylvania, and many of them have been built in the 60s, 70s, and 80s, and maintenance has been minimal at many places. And many are suffering from a huge backlog in maintenance requirements. But because they don't have either the money or the capacity in manpower and physical facilities to maintain it, these things aren't happening. And so it becomes what we call a backlog. A study was done on just the 121 state parks and the state forests. And between them alone is $1 billion of backlog in maintenance that's required. And some of them are huge, like repairing a dam or a bridge or an access road. Now, many of our local parks, 6,000, don't have quite the same size of facilities. They may not need to repair a dam, but they have a playground from the 80s that isn't quite as safe as it used to be. And things are wearing out. And we get to the point where we could, to borrow the term from biology, a park may become endangered, which is in danger of becoming extinct, which means there may be sections or whole parks that may need to be closed because of the hazards have become too great to allow public access. Now, in most places, we aren't quite to that stage, but it is alarming. And during the pandemic, a lot of local agencies laid off or furloughed recreation and park staff, including maintenance staff. And so they have done only what was crucial during the time. And unfortunately, this is tied into the funding of local parks and rec. If they're not able to produce the programming that produced revenues, why their budget is automatically cut back. I know of one agency that 85% of their annual revenues were self-produced through the programming that they offered to the public. Well, without that happening, they don't have the money, and some of these people have been furloughed for good. In other words, they've lost their jobs. So the impact is going to continue to ripple across the state from this. It's not quite like I'm seeing the stock market rebound. There's a big V shape in the graph of performance among stocks and investments, which is encouraging. But in the world of parks and recreation, it's not going to be quite that quick of a rebounding. And we're hoping that the renewed attention that came to parks during the pandemic, because, hey, where else was there places to go? That this will translate into some longer-term, higher priorities for decisions on our parks and public spaces and on its funding, so that we can bring them up to higher maintenance levels and higher levels of engagement, which is what our public needs.
We only have about a minute left. What kind of protocols are you advising for park managers as the different counties start to navigate reopening, and how will that experience visiting parks be different as counties start to go into the green phase?
Well, I would encourage them to go to the Pennsylvania Recreation and Park Society website. That's prps.org. And we have a slider right on the homepage that'll take you to our Pandemic Resources Center, where there are many different categories of aids and helps. In the one under planning is our reopening guidelines, and they can download that there. And on that, we have about 30 pages of information and resources for athletics and activities, indoor facilities, outdoor facilities, large venues, water-based recreation. So they can go to each of them, like contact sports, basketball and volleyball, or multi-purpose meeting spaces, or marinas or pools. And on each of those are some guidelines on physical distancing, ratios and groups, square feet and capacity, check-in and check-out procedures, visitors, sanitation, hygiene, all those kinds of things that may apply to, again, help them to be able to make these programs and facilities ready and available when the time comes, yellow or green or beyond.
We've been speaking with Tim Hurd. He is CEO of the Pennsylvania Recreation and Park Society. Thank you for joining us today.
My pleasure. Thank you.
PCN brings the distinct aspects of Pennsylvania and its residents to your favorite screen.
Hear from state government and community leaders during unedited, balanced coverage of politics and policy.
Dig into the rich history and culture of the state, presented by notable residents and historians.
Score a view of the best high school, college, and world-class athletes competing across the state, and much, much more.
Start exploring the Keystone State today on PCN and the PCN app.
I'm joined today by William Rossey. He is Borough Manager of Sharpsburg. For those that are not familiar, can you talk a little bit about some of the challenges that you've experienced as a local government official since the coronavirus has reached Pennsylvania?
It's been quite a challenge. We're located in Allegheny County, just about 5 miles outside of the city of Pittsburgh. And the biggest challenges we face is just, trying to keep our businesses in a good position, keeping them up to date as to what's going on and what can and cannot be done. So it's been quite a challenge just to take care of the residents of our borough and make sure that they're safe and they're informed and they have the resources that they need to go on and live somewhat of a normal life.
Can you discuss and perhaps explain the difference between essential versus non-essential services and how this affected your ability to function as a local government entity?
Well, yeah, we are essential. I oversee the police department here, our fire department. So, we're very cautious on what we did and made sure we had all the PPE that we needed, and kept reminding everyone, stay safe. It's very important that we keep everything in perspective as to what we're doing.
What effect did business closures and the general stay-at-home policy have on the local government budget?
Well, that's yet to be seen. That's a question that we're all asking each other. The first quarter of the year wasn't affected very much because mostly everything remained open and was functioning as normal. This second quarter that we're in right now and will be ending in June has yet to be seen. We've had a lot of discussions with our state representatives in Harrisburg, our local council of governments. We've been discussing with all the communities surrounding us and our council of governments, which there's 20 local communities in our COG, and just what effects we can possibly anticipate. There's a lot of spending that we put on hold right now. Like in Sharpsburg, we've suspended paving for this year at this point. We did have money budgeted for that, but we just put that on hold. Luckily, we had a mild winter, so some of the streets really didn't get beat up too bad. But we're looking at earned income tax. That's between earned income tax, local service tax, mercantile tax, business privilege tax, liquid fuels taxes through the state. Those make up almost 25% of our budget, those funds that we receive. So we don't know where we're going to be. I mean, with the unemployment that's across the state and the country, a lot of people aren't working, so they're not paying earned income tax. They're not paying the local service tax. People weren't driving, and gas got pretty cheap. So those gas taxes, those liquid fuels go to help repair our roads, pay for street lighting, pay for road salt. So that's going to take an effect on us too. So those are some of the things that we're looking at. Sales tax, local sales tax in Allegheny County, there's a 1% sales tax added to the normal 6% across the state. And we do get some of that money back from the county for that local sales tax. All that's going to be affected. And the next quarter, probably the third quarter, is when we'll really see what impact that has. I've talked with our local tax collectors. Fortunately, our real estate tax doesn't seem to be taking as a big a hit, and that's mainly because a lot of homes are mortgaged, and if you have a mortgage through a bank, they do escrow your real estate tax. So we have been getting our real estate tax in pretty fairly as what we expected, but time will tell on that also.
State lawmakers are approaching Pennsylvania's budget in a two-pronged way this year. So the first part has passed already, looking at the first 5 months of the fiscal year, and then a second piece is anticipated to be dealt with in November. What do you think about that? Does that help you in terms of predictability?
No, not yet. I mean, it's really, this is all too early for us to really, we've never experienced anything like this. And we're here at the Borough, we're just opening our doors back up. Actually today, we're open back up to let the public come in as long as they're wearing a mask, social distancing. We're going to open up some of our parks to let people use them. Our baseball field is opening today so that kids can get out and start to play Little League baseball. But we've got to follow all the proper procedures in social distancing and sanitizing and so forth.
As a local government entity, do you feel like any of your legislative priorities have been perhaps put on hold because of all the emphasis on addressing the immediate needs related to the coronavirus?
No, I think our legislators have been working pretty well with us. I guess my biggest question I've been asking them is, unemployment compensation and our unemployment compensation rates that we pay. Those are definitely going to be affected. And local government, we really didn't have that many people we put on unemployment. In fact, here at Sharpsburg, we really didn't lay anyone off. We kept everyone working. We have a small staff. But businesses that pay unemployment compensation tax, from what I'm hearing from Harrisburg, they're going to take a hit when this is all over, and they're going to pay a higher rate to make up that money that was in that unemployment fund. Somebody's got to pay for it. And unfortunately, it looks like the business owners are going to have to pay that. I wish that, legislation would do something to help that and fund that a little better.
How do you determine how and when to open up amenities deemed non-essential, things like swimming pools, parks, and perhaps summer events?
That's tough. I mean, we're using it. Yeah, we're going little by little, and what's really helped us is the 20 communities that we're in the COG together with. We communicate with each other. Other communities have pools. Some are talking about opening them in a few weeks. We don't have a swimming pool here. We said we do have a couple parks. We do have a boat marina and a public boat launch that we did open, and we are using the universal precautions and all the PPE that we need there, and just trying to make people understand that this is open as long as you use it in the right way and we protect each other.
We've been speaking with William Rossey, Sharpsburg Borough Manager. Thank you very much for joining us today.
You're quite welcome. Thank you for having me.
How did that become law?
Does the governor get to decide everything?
Why was that person elected?
PCN wanted to help answer these questions by creating CIVICS 101, a free online educational tool to teach Pennsylvania students how the state government works. Stream video interviews with elected officials, tour the state capitol and governor's residence, and so much more. Go to PCNTV.com to start learning today. PCN CIVICS 101.
I'm joined today by Jim Worthington. He is a member of the President's Council on Sports, Fitness, and Nutrition, and also owner of the Newtown Athletic Club. How has the fitness industry been affected by the coronavirus pandemic and the workplace closure orders that have ensued since then?
Well, nationally, it's been devastated, and certainly statewide, it's been devastated. They're expecting after 3 months, it could be anywhere from 30 to 40% of clubs domestically and statewide closing down, never reopening. So it's basically gutted our industry, and not, of course, just not only shutting down jobs, costing or shutting down businesses cost many jobs. And on top of that, you've got people that have sat around for 90 days and have not exercised. So it's not been good, emotionally, physically, mentally. So it's been just the worst thing. And I've been in the industry 42 years. It's just been by far the worst thing that's ever happened to our industry.
How does Pennsylvania compare with other states in terms of whether or how fitness centers have been able to operate?
Frankly, horribly. The president came out in the beginning of, or right before May 1, said that he recommended that the health club industry be opened up on May 1 nationwide. Approximately 30 states to date have opened up. Basically, mainly the Republican states. The Democratic states have not embraced exercise as medicine, and that wellness is a big part of getting people, keeping people well, building immunity. Frankly, chronic disease, 80% of chronic disease is prevented by exercise, good nutrition, not smoking, and limited drinking. Half the country seems to think that we're essential, and then half the country that are in Democratic states have really. I was just talking to a friend of mine in Chicago. They're looking at 3 months from now, the devastation that will cause to people in terms of illness and chronic illness and heart disease and so on and so forth. Is just devastating. So no, it doesn't stack up very well.
There have been times when the recommendations of state and federal officials have contradicted one another. As a business owner, how do you navigate that?
Well, it's tough. I mean, a good friend of mine that owns is a big part of a chain called Lifetime Fitness, Borough McCarty, says the biggest problem with this whole thing is just not the ability to figure out when you're going to open up again. So you can't plan as a business person. I originally was told that we had to flatten the curve. And, I figured we were told it was going to be 2 or 3 weeks. Well, you plan for 2 or 3 weeks, and 90 days later, in my case, I'm out $7 million in revenue. I had planned construction during the time because I thought I would have cash flow to pay it, which was $3 million. Once we got into it, we couldn't stop it. So I had to, basically liquidate my retirement account, put everything else I had up for that I own for sale other than my business and my house, just to finance all these things. It's, and thank God I've got the means, maybe, a lot of people don't, but unfortunately most business owners don't have the means to do that. And they're out of business now. So it's been nothing but stress. I mean, only my faith in in my members and my staff, and the fact that there's an old saying: when you owe the bank a little bit of money, they own you. When you owe a lot of money, you own them. I owe $35 million here. So the bank's not going to let me fail because they don't want to operate my club. But the reality is that there's a big burden there, and I'm piling up debt as we speak every day. So it's been tough.
What measures have fitness centers taken to continue to serve their members remotely while everybody was on a stay-at-home order?
Well, I mean, I think it accelerated the on the internet type virtual classes. It's something that we've all been working towards. It's accelerated it, but let's be honest, nothing replaces being in a health club or in a sports setting for kids. I mean, the fact of the matter is people, if it was that easy, their health clubs wouldn't have existed in the first place. There's more to than just getting on an exercise bike. There's the camaraderie, the socialization, the mental health. I mean, I think the fact that this is a community of people. In our particular club, we've got 12,000 members. There's a reason they come here, because we are the center of the community. And every day I look out my window and a number of people come up and take selfies out the front door. And, they drive up with their kids and they wave through the window. I mean, this is a community within a community. So it's had so many side effects and things that have just been devastating to people.
Now, you mentioned kids. Typically, when somebody talks about health clubs, you might think about it solely referring to adults. Does this have effects on other segments of the population, like perhaps children's sports? Sure.
I mean, first of all, I'm a member of the President's Fitness Council. So, I mean, prior to this pandemic, youth sports had decreased in the last 6 years from 45% to 37%. And it was continuing to drop. Two reasons. One, it's not fun. And two, the cost. Now kids have been gotten away from it. They project that the decrease in the last 6 years will be equal this year to the last 6 years, because, again, kids have gotten away from it. Once you get sitting home and get used to being on your devices and you get lazy, it's hard to get kids motivated again. 70% of the kids age 13 stop playing youth sports at that age. So that's not only bad in the sense that it's sports. What's really important, they're not active. So, I mean, when you're not active, it leads to all kinds of other things, social issues, drugs, alcohol. I mean, just plain getting into trouble because they're just not active. Another statistic you should know, the age group 17 to 24 before this pandemic, 70% of them would fail the fitness exam to get into the military. That was before the pandemic. So that's a national security issue. I mean, frankly, exercise is medicine. What we do is essential. We should be part of the wellness community. The fact that we've been left out in Pennsylvania is a travesty. June 15th will be 3 months. I had no problem with it the first couple months. I'm a little bit annoyed it's taken this third month. Come June 15th, unless the governor has something, some encouraging words today to say about Bucks County in regards to, hey, we're closed, it's a couple weeks away, whatever. If I don't hear that today in his press conference that's going on right now, we're opening June 15th.
What guidance have you been given regarding health clubs that are starting to be in the green phase of reopening? What kind of protocols do you need to follow to open safely?
Okay, well, first of all, I'm glad you asked that question, Francine. Our club, my club, the Newtown Athletic Club, in coordination with my employees, basically set the standards, not for my club, not just for Pennsylvania, not just for the domestic industry, the entire global industry. We, through my relationship with the Surgeon General, Jerome Adams, and his ability to get us through the CDC in Washington, we accumulated information in April for the entire industry to put together in a plan that we submitted to the CDC, who worked with us to approve it and to make it as good as you can be. We then distributed that throughout the entire industry through an organization, URSA, which is the largest trade association in the world, which I was the chair of last year, and I'm the ex officio. So literally, we have through this club in Pennsylvania, we have set the guidelines for the entire global industry yet. And they're extensive. They're more extensive than any other industry you can think of, because remember, we're in the health and wellness business, and, temperature checks at the front door, social distancing, cleaning, all, defogging, lighting, everything you can think of. We came up with. It's pages and pages of documents. I mean, it's just unreal what we've done. And yet I said that we've done that for the industry. And here I am, the guy that put it together, and we're sitting closed. It boggles my mind. Answer to your question, everybody that opened up in May, not one person, not one club company that I know has reported any incidents of COVID, any problem, any result of them opening up. Not one. In the entire 30 states that have been open, the clubs have been. So, here we are, just, in our state where we could actually help keep people well. We're sitting on our hands, not allowing it to happen. It's just so frustrating.
Once the counties are green and gyms begin to open, how will the experience be different for members?
Well, first of all, you won't be able to, you won't have as many people come in at one time. If you have group exercise type activities, you'll have to have less people. You'll have to spread people out. But to give an example, in my particular club, it's on 26 acres, 250,000 square feet. So it's about 4 times bigger than a Walmart. We have outdoor and indoor facilities. We're the 3rd largest health club in America. For me to social distance people is easy. I mean, because I'm huge. Now, the smaller clubs, they'll have a little bit more of a difficult time, but they will be able to do it because there's going to be capacity constraints, which they will clearly abide by and honor. And because remember, we're, again, health clubs. We want to keep people healthy. This is our life work. And by the way, I just want to tell you, when I do open up on June 15th, I won't be charging my members until the governor allows us, because I don't want to hear anything about, I did that for monetary reasons. There will be no charge until the governor says that we can be open. So in that way, I'm actually protesting the fact and putting, my livelihood to the side to say, I believe so much in what I do, is I'm going to open my doors and not even charge until you tell me we can. Ironically, I will say this, in my own community, not too far, within miles of me, a number of health clubs have already opened up as early as May 23rd. And good for them. I have no resentment. I'm happy for them, but it's going to be interesting to see, because of my size and our status in the industry, whether I'm going to be singled out. I hope not, because I know a lot of people have already opened up, and I think I should be treated like everybody else.
We've been speaking with Jim Worthington. Thank you so much for joining us.
Thank you.